treatment. One thing that we are not is we're not a treatment technique, okay? Trigenics is not a treatment technique. We're an entire full global body treatment system, assessment and treatment system. And we're not a soft tissue treatment technique. We don't actually treat the histology. We don't treat the soft tissues. We don't try to change the consistency of the tissue in any way. What we try to do is change the neurology, the aberrant neurology of the tissue. And then we will send out the patient or do it ourselves if we're in, if we do a Graston technique, which is fabulous for addressing histology and the soft tissue components, we'll combine the Trigenics with a Graston and combine it with a manipulation when it's still required, just so that that dispels any notions so you understand where we're coming from. And we'll talk a lot more about that. So what you're going to do is you're going to breathe in through your stomach and your nose. And you're going to breathe out slowly like this. As you exhale, what I want you to do is I just want you to focus on, you're going to move your arm very, very lightly, and I'm going to just resist it. There's very light resisted movement involved in this Trigenic strengthening procedure to try to enhance the neurological input that was actually reciprocal inhibitory input to the muscle. And as that happens, I'm going to manipulate the mechanoreceptors. That's going to change the gamma bias, or the firing pattern of the muscle, and increase the cross-bridge binding potential and make it stronger, to make a long story short. And we'll put it in simplistic terms in a second. But what you're going to do is you're going to slowly come back like this, but you're not going to go real hard. You're going to go nice and light, and you're going to focus on actually relaxing this muscle as you come back. So there'll be a certain amount of pressure that causes it to drop in, just like that. Okay, so what I want you to do is breathe in for me. And breathe out slowly, coming back. Come right back. Come back a little bit more. Back. That's good. Now, we're not using a direct ischemic compression pressure here. It's a form of manipulation that we're doing, even though you can't see what my thumb is doing. Breathing in. And coming back. A little more, a little more, a little more, a little more. Very nice. And breathing in again. And slowly back, coming back as you breathe. Drop it down. Come back a little more. That one's a little tough. Let me just get that right here. We got a little tough spot there. So what you're going to do this time is you're going to just come back with your elbow. Okay, here we go. Breathe. And come back with the elbow. Yeah, right there. That's right where you are, right there. Very nice. Let it go. Got one more on it. Breathe. This little part of minor right here where it comes down to that second rib has just been like this for a little too long. We have our Tim, independent tester, is going to come back up again. And now he's going to test that. You can just test the one that was weak. Okay, you're going to have to hold your arm down. Okay, go ahead.
Much stronger.
How much stronger does that feel to you?
A bit.
Right. Thank you, Tim. Let's have a hand for Tim. All right.